In 1932, deep in rural Alabama, hundreds of poor black men were told they were getting free medical treatment from the U.S. government. They trusted the doctors, they trusted the uniforms, they trusted the promise of care. What they did not know was that they were being used as human test subjects in a secret medical experiment, an experiment that would last 40 years. The disease was syphilis, a deadly infection that slowly destroys the body and mind. Instead of curing it, the government chose to watch what would happen if it was left untreated. The men were never told the truth. They were told they had bad blood, a vague term used to hide the real diagnosis. The experiment was run by the U.S. Public Health Service, a government agency meant to protect health. Instead, it betrayed it. More than 600 men were enrolled. About 400 already had syphilis. The rest were used as a control group. The doctors promised free meals, free checkups, and burial insurance. For men living in extreme poverty, this sounded like hope. But behind closed doors, the doctors made a horrifying decision. They would never treat the disease. In the 1940s, a miracle cure appeared: penicillin. It could cure syphilis completely. The doctors could have saved the men. They chose not to. Instead, they blocked the men from receiving treatment anywhere else. Even when the men were drafted into the army, doctors stopped their treatment orders. The men slowly began to suffer: blindness, insanity, organ failure. Many wives were infected. Children were born with congenital syphilis. The experiment continued year after year. New doctors joined. No one stopped it. For 40 years, the truth was hidden in government files. The men still believed they were being treated. In 1972, a whistleblower leaked the story to the press. The world finally saw the truth. Public outrage exploded across America. People could not believe their own government had done this. The experiment was shut down immediately, but for many men, it was already too late. By then, dozens had died directly from syphilis. Hundreds more suffered permanent damage. In 1997, the U.S. government finally apologized. President Bill Clinton called it a shameful act. But an apology could not restore lost lives. It could not undo decades of pain. The experiment destroyed trust in American medicine, especially among black communities. Even today, its effects are felt. Many still fear medical systems because of what happened. This was not done by enemies. It was done by the government itself. Doctors became observers instead of healers. Science became cruelty instead of care. The men were never given a choice. They were never given the truth. This was not just racism. It was betrayal. History books mention it briefly, but its lesson is massive. Power without accountability creates monsters. Even in medicine, the Tuskegee experiment proved something terrifying. That cruelty can wear a lab coat. Many families never received justice, only silence. This was America's darkest experiment on its own people, hidden in plain sight. It reminds us why ethics exist and why secrets are dangerous. Because when humans become data, humanity disappears. And when truth is buried, history repeats. The men believed the doctors were helping them. Trust was used as a weapon. Every test result was recorded. Every symptom was observed. No cure was ever given. Science journals praised the study. Few asked if it was moral. To the doctors, the men became numbers. Not fathers, not husbands, not human beings. The experiment continued through wars, presidents, and generations. No one stopped it. Some doctors knew it was wrong. They stayed silent anyway. Fear of losing jobs kept mouths closed. Power kept truth buried. When the story finally broke, Americans felt betrayed. Trust in medicine cracked overnight. Laws were changed because of this case. Ethics boards were created to prevent it from happening again. Consent became a legal requirement. Truth became a moral duty. But scars remained in families and in communities. Stories were passed down as warnings. Never trust blind promises. Some victims never lived to hear the apology. Justice arrived too late. The experiment became a lesson taught in medical schools. A reminder of what not to become. It proved that evil doesn't always look violent. Sometimes it looks professional. White coats can hide dark intentions. Paperwork can hide pain. This was not ignorance. It was a choice to observe instead of heal, a choice to lie instead of save. History remembers wars and heroes, but it often forgets victims. These men were never famous, yet their suffering changed medical law forever. Their pain became protection for future patients. Their story warns us what happens when power goes unchecked, because the most dangerous experiments are the ones done in secret, and the most dangerous lies are the ones told by those we trust. This was America's darkest experiment on its own people, and it must never be forgotten.